There are several things about Baylor Medical Center at Uptown that have allowed us to perform advanced recovery or accelerated programs, also known as the same-day joint replacement program.
The nice thing about same-day joint replacement is ultimately almost any joint that you replace, whether it be a shoulder, a knee, or a hip, can, in the right setting with the right patient, can be done as an outpatient surgery.
So one of the important things to realize for a patient who's going to go through same-day joint replacement is that there needs to be a significant amount of education given prior to surgery.
People are anxious about surgery, as rightfully so, and ultimately a class ahead of time that the hospital offers is a wonderful way for them to prepare for this, including telling them about all these steps and people involved.
After the patient has spoken with the physician and has chosen to have a same-day joint surgery, the patient will receive a phone call from a nurse from the pre-admit department, and that nurse will gather information relating to the patient's medical history, surgical history.
One of the important things that happens during your pre-surgery consultation with your preoperative nurse is going over your list of medications. One of the reasons for this is there are several types of medications and medication classes that we want you to stop prior to surgery.
It's important for same-day joint patients to have their home ready, so we'll provide a checklist for them that they'll be able to go through and prepare their home prior to the surgery. So going home the same day as your surgery, you're going to require a little bit of assistance from family members or a neighbor. So it's important, if you can, to have somebody stay with you for the first 24 hours, or at least have somebody available via phone 24 hours a day, 7 days a week, to provide that assistance when needed.
Infection control is based on a number of different measures. The guidelines tell us that we need to give antibiotics in the IV form before surgery, and then they can be either orally through the mouth after surgery or here in the hospital.
So on the day of surgery, you need to bring the adult that's going to assist you with your immediate post-op care. When you come to Baylor Uptown, be prepared to spend a full day here. We do have options in case you need to stay the night. On the day of surgery, the patient will come in the AM to register for Baylor Uptown. That way they get an armband and we do more checks and balances. Once they're done with the registration process, the patient will go to pre-operative holding. They will get a nurse who will go over their consents for surgery, make sure it's the correct doctor, the correct patient, more checks and balances. They will obtain an IV for medication and fluids, and then the doctor will come and see them before surgery, and the anesthesiologist will come as well, and they will discuss their plan for anesthesia. Once the patient is registered in pre-op, they are taken to the OR by the anesthesiologist and the OR nurse. They'll spend about 2 hours in the operating room, and then they'll come to recovery, still sleepy, and they'll spend about 3 to 4 hours in the recovery room. The recovery room nurse helps wake the patient up. We obtain vital signs, including blood pressure, oxygen saturations, and we're constantly monitoring them to make sure they're not having any complications from surgery. We do control their pain levels. We give them IV pain medication. Once the patient's pain is under control and they've woken up enough from surgery, we can start out with clears, ice chips, water, advance them to juice and soda, and they can also have some crackers. Once their pain is still tolerable and they've tolerated food, then we decide if they're ready to have physical therapy.
One of the most important things for same-day joint surgery is going to be the physical therapy after the surgery. The surgery will set that joint up, and physical therapy will carry you on through your recovery. So that's going to be working on range of motion, strengthening, and making you become functional after the surgery. For the same-day joint program, physical therapists will see you after the surgery and will get you up immediately. You'll be walking with a walker or crutches, and you'll be working on transfers, getting in and out of bed, up and out of the chair. It's really important that you start moving soon after surgery so the joint doesn't become stiff and you have issues down the line. Each same-day joint patient will be given a home exercise program that you will continue to perform multiple times in a day until you meet with your physical therapist, whether it be a home health physical therapist or outpatient physical therapist. You'll perform these multiple times, and you will have pictures and instructions that will explain to you on how to do these exercises properly.
In order to be discharged from our recovery room, your pain needs to be tolerable. You need to be able to do your physical therapy at home. The physical therapist must clear you to be able to do these therapies at home. The nurse will go over your discharge instructions relating to changing your dressings, how to take your medications, diet, food. Most any questions that you have will be addressed by your recovery room nurse and your physical therapist. Once you're ready to go home, the nurse takes out your IV, you have all the supplies you need to go home, we sit you in a wheelchair, we wheel you down to the valet, and then expect a phone call in 24 hours from our nurses asking you how you're doing.